From the vibrant beach murals to the bustling streets of downtown to the serene neighborhoods lining the coast, every corner of Long Beach tells a story of its own. Here, amidst the palm trees and ocean breeze, lies a community pulsating with diversity, creativity, and resilience. Beneath the surface of this picturesque facade lies a tale of disparity and challenge. Long Beach is not just a city. It's a mosaic of cultures, languages, and traditions that converge to create a dynamic and eclectic urban landscape. Population of 460,000 residents, 42% Hispanic or Latino, 30% white, 14% Asian, and 12% African American community. The unemployment rate is currently 62.9%. We began this journey at Christ the Good Shepherd American Coptic Orthodox Church. Every Saturday, they host a food bank for the community and supply them with groceries for the week. They even started hosting an additional food bank on Wednesdays because the need was so large. Members of the community can come and pick up boxes of various food items ranging from produce, meats, dairy products, and so much more. Community member Aziz manages the food kitchen at the church every weekend and discusses her experience.
Aziz, I am volunteering in God Shepherd Church, Long Beach. Almost 5 years here. 120 for the homeless people, and the volunteer come like from 30 to 40 because Buna invite students from different churches to help, and this is a beautiful day for us.
Longtime resident of Long Beach and volunteer of Christ the Good Shepherd Church, Sylvia Juarez, spoke to us about the needs of the community and her experience living in Long Beach.
There's so many transients out here, people on the street. Like some of them, I watched them grow up, but I see them on their bicycles and in the street. You never know what people go through. You just don't know. The stores is kind of scarce, and like the one Dollar Tree we have in the neighborhood that people go to all the time, they get ready to close it down. Everybody doesn't have EBT. Some people work. You can't afford it. So when you go to the store, they triple the price of everything. I really believe they have a good system in Long Beach. They have a lot of food giveaways out in Long Beach. I don't think there's enough jobs. They don't make it available. There's too many stipulations. Like I've applied for a lot of positions, but they would ask me questions, but I have the qualifications. But I think that kept me out of a lot of jobs.
Physician assistant Marissa Menendez has been practicing since 2007. She discusses her experience volunteering in the Long Beach community and providing medical service to the underserved and refugees.
Mental health, behavioral health types of things, there's definitely not a whole lot of access for those things, privately or, public, at least that we see advertised.
She reflects on the barriers to access to healthcare in the Long Beach community, mentioning extensive wait times at the Long Beach Memorial Hospital, up to 18 to 21 hours, difficulty seeing primary care providers and behavioral specialists even with health insurance.
We're seeing a lot of the maintenance stuff, unfortunately, blood pressure, cholesterol, diabetes, a lot of depression, a lot of anxiety. I think it's sad that there's not enough preventative medicine happening.
Food security issues are prevalent with residents as they struggle to access healthy and affordable foods. Most patient clinic visits are related to blood pressure, cholesterol, diabetes, depression, and anxiety, which she feels lends to the bigger issue of a lack of preventative health initiatives.
A lot of issues for access to good healthy food. Obviously there's going to be a socioeconomic, reasons for those things, but even those with insurance, depending on the hours they're working, they're not going to have access to good, food wherever they're working. They're going to be eating fast food, and if they don't have the nutritional background, they're still going to probably make the poorer choice. Definitely in our clinics, we have food banks and things that we're trying to provide them food, but sometimes we're just trying to provide them food, so it's not always going to be the most nutritious things, but just they have some nourishment. The free clinic here offer physical therapy, acupuncture, and connections to dentists that will provide them free services. And a lot of them are walking pretty far distances, at least at this free clinic, and busing, which they're actually walking pretty far sometimes from far parts of Long Beach, or taking buses even because they know that it's here, they know that the food bank's here, and they have their little carts, and they, walk pretty far distances and back. Most of them are locals, but every now and then I'm surprised by how far some patients will come.
Amidst these challenges, Long Beach is also a beacon of resilience and hope. Through grassroots activism, innovative initiatives, and the transformative power of art and culture, the community is forging pathways to health and wellness for all its residents.